Hello, and welcome to Midlife and Mighty. My name is Dr. John Kenny. This channel is dedicated to helping adults over 40 stay strong, energized, and healthy for life. Here, we focus on healthy aging, midlife fitness, longevity habits, and mental wellness, designed for real people, real bodies, and real lives. Today, we're talking about something we all experience, yet rarely think deeply about: sweat. Why do we sweat? What does sweating say about your health? And how does sweating change after 40 when your body no longer responds the same way it did in your 20s or 30s? Understanding sweat isn't just about comfort, it's about listening to your body and recognizing important warning signs before they become serious problems. From a medical perspective, sweating is one of the most important survival mechanisms your body has. Your body works constantly to maintain a stable internal temperature. Even small increases in temperature can place stress on your organs, your brain, and your cardiovascular system. When your internal temperature rises, whether from exercise, hot weather, emotional stress, or illness, your brain sends signals to specialized glands in your skin called sweat glands. These glands release sweat onto the surface of your skin. As the sweat evaporates, it removes excess heat and cools your body. This cooling process is essential for preventing overheating, protecting vital organs, and maintaining overall balance inside your body. Without the ability to sweat, even light physical activity could become dangerous. As we age, this temperature regulation system becomes less efficient. After 40, nerve signals may not travel as quickly. Sweat glands may respond more slowly. Blood flow to the skin may decrease. All of these changes mean your body may not cool itself as effectively as it once did. That's why heat tolerance often declines with age, and why paying attention to sweating patterns becomes increasingly important after 40. Let's address a common misconception. Many people believe that sweating detoxifies the body. Medically speaking, this is not true. Detoxification is primarily the job of your liver and kidneys. Sweat is composed of about 99% water, with small amounts of salt and electrolytes. The main role of sweat is temperature regulation, not toxin removal. That said, sweating does affect hydration. Losing fluids and electrolytes without replacing them can lead to fatigue, dizziness, muscle cramps, headaches, and reduced physical performance. Older adults are also less likely to feel thirsty, which increases the risk of dehydration. That's why consistent hydration is a critical part of maintaining good health, especially as you age. There are two main types of sweat, and understanding the difference matters. The first type is eccrine sweat. These glands are located all over your body and produce the clear, watery sweat most commonly associated with heat and exercise. Eccrine sweat helps cool the body and is generally odorless. The second type is apocrine sweat. These glands are found mainly in areas like the underarms and groin. Apocrine sweat is released during emotional stress, anxiety, or nervousness. It contains more proteins and fats, which bacteria on the skin break down, leading to stronger body odor. This explains why stress-related sweat often smells different from exercise-related sweat. It's important to understand that sweat itself does not smell. Body odor occurs when sweat interacts with bacteria on the skin. As bacteria break down substances in sweat, they produce odor as a byproduct. Changes in hormones, diet, medications, and stress levels common factors after 40 can all influence body odor. Managing stress, maintaining good hygiene, wearing breathable clothing, and staying hydrated can significantly reduce odor naturally. Now let's talk about a commonly overlooked area, your feet. Each foot contains more than 200,000 sweat glands. When sweat becomes trapped inside shoes, especially shoes with limited ventilation, it creates a warm, moist environment where bacteria and fungi thrive. Over time, this can lead to foot odor, fungal infections, cracked skin, and discomfort. Aging skin is thinner and more prone to irritation, which makes proper foot care even more important. Simple habits, such as rotating shoes, wearing moisture-wicking socks, allowing shoes to dry fully, and keeping feet clean and dry can greatly improve foot health. For most people, sweating is completely normal and healthy. However, certain changes in sweating deserve closer attention. Excessive sweating that occurs without heat or physical activity may be a condition called hyperhidrosis. While it's often not dangerous, it can interfere with daily activities, emotional well-being, and confidence. The good news is medical treatments and lifestyle strategies are available. More concerning is the opposite problem, not sweating enough. This condition is known as anhidrosis. When the body cannot sweat properly, it loses its ability to cool itself. This significantly increases the risk of heat exhaustion and heat stroke, particularly in warm environments or during physical activity. There are also specific warning signs you should never ignore. Sudden heavy sweating without an obvious cause, unexplained night sweats, or sweating accompanied by chest pain, dizziness, nausea, shortness of breath, or weakness. These symptoms require medical evaluation. In some cases, they may signal infections, hormonal imbalances, heart conditions, or other underlying health issues, especially after 40 when risk factors increase. Listening to these signals and seeking care early can prevent serious complications. Many people ask about deodorants and antiperspirants. Deodorants help control odor by reducing bacteria on the skin. Antiperspirants reduce sweat by temporarily blocking sweat glands. Both products are generally safe, and current scientific evidence does not support claims linking antiperspirants to cancer. As skin becomes more sensitive with age, choosing products that match your skin type and avoiding irritation is important. Sometimes switching formulas or using fragrance-free options can make a big difference. From a broader perspective, sweat is part of a larger conversation about aging well. Changes in sweating can reflect changes in circulation, nerve function, hydration, hormone levels, and stress response. These systems are deeply connected. Paying attention to sweat patterns is another way of staying in tune with your body. Rather than seeing sweat as something uncomfortable or embarrassing, view it as useful information, your body communicating with you about its needs. So what's the takeaway? Sweating is not a flaw. It's a vital function that helps protect your health. Understanding how and why you sweat empowers you to recognize normal changes, respond to potential warning signs, and support your body more effectively after 40. Staying hydrated, managing stress, dressing appropriately for temperature, and listening to your body's signals all contribute to aging with strength and confidence. If you're over 40 and want to stay active, protect your health, and live with purpose at every stage of life, subscribe to Midlife and Mighty. Here, we share doctor-guided insights, gentle fitness guidance, and practical wellness strategies designed to support longevity without extremes or pressure. Thank you for watching. Take care of your body, respect the signals it sends you, and I'll see you in the next video.